So thank you, Commissioners, for this time today to provide a COVID update. I did just want to remind our community members who are listening in that at our last update on March 15th, we have moved to providing briefings once a month at the first Commissioner's briefing beginning this month. And we'll continue this format for at least 1 to 2 months before moving to no scheduled briefings unless requested from you all. As of yesterday, there have been 52,259 total confirmed cases of COVID-19 in Buncombe County since the pandemic started. Our case rate has remained low and stable for about 3 weeks. You can see that very pronounced peak there of Omicron and then a very precipitous decline, and now we are at very low levels, and for the last 3 weeks have been at a very low level and plateauing, it appears, at a very low level. As of yesterday, the case rate was 40 per 100,000. And as I said, this has not changed significantly for the last 3 weeks. Hospitalizations also remain low and stable. Buncombe County has experienced 552 COVID-19 related deaths, with 3 being added in the previous week. The current community level status for Buncombe County remains green or in the low level. This marks the 3rd week in which Buncombe has been at a low community level. The community recommendations at this time, at this level, are to stay up to date on vaccines and get tested if you have symptoms or an exposure. I did want to note that the North Carolina Department of Health and Human Services did successfully transition their COVID-19 dashboard to a weekly update, and that began on March 23rd. North Carolina DHHS has begun to transition their data dashboard to reflect this new phase of the response, and has more of a focus on surveillance and monitoring systems, while maintaining some of the original components, such as the case rate, the hospitalization data, and the vaccination rates. But I will also mention that those original components will begin migrating to a weekly update beginning April 6th, so this week. For more information or to visit the new dashboard, folks can visit covid19.ncdhhs.gov/dashboard to view those changes. So let's talk a little bit about operations as COVID-19 response continues to be integrated into regular operations for local public health. While there's not been much change in the overall proportion of vaccinated amongst the different age groups, each week we do continue to see the total number or the absolute number of vaccinations administered increase. So more than 180,000 individuals have received at least 1 dose at this time. Over 172,000 have completed their series, and now over 100,000 have received a booster or additional dose. I will also want to remind folks that in the last week, we've also seen the addition of the second booster for those 50 and above and immunocompromised individuals. I did want to share some equity-focused data, particularly around race and ethnicity, that while vaccine rollout has largely been based on age groups, that we've rolled out much of the vaccine based on where you fall into a particular age group. I did want to take a moment to talk about the progress that we've made in the equitable distribution of vaccine. This slide is actually showing the percent of that particular population with at least 1 dose. So if we look at the first graph, we are seeing vaccine as a function of race. You can see that in the very early months, when much of our efforts and much of the efforts across the state were centered on mass vaccination sites like the one we had at AB Tech, we saw a greater disparity. But as time went on and vaccine providers, including ourselves, began to focus on equitable distribution and going out into communities, out into neighborhoods, working with community organizations and community health workers and with schools, we see that gap begin to narrow between our African American population and our white population. Still not exactly what we would like to see, but as I talk further in the slides about where we are with our mobile team, that is the hope that will continue as we hire our communicable disease and infection prevention mobile team, that we will continue this equity-focused vaccine effort into neighborhoods, into communities, working with community health workers in historically marginalized communities, low-income communities, and rural communities. The second graph is actually showing vaccine as a function of ethnicity. And here we see a very similar start with a disparity between non-Hispanic and Hispanic groups in the early months. But again, as equity-focused efforts began to be implemented and relationships, particularly with groups like the Mexican Consulate and Healthier Together, were established, we see the disparity actually close in this particular group. And actually see a greater proportion of Hispanic population receiving at least one dose compared to non-Hispanic. And as I just mentioned, we do hope to continue to make strides in our equity-focused approach going forward as we establish our mobile team. I did want to mention to you all that those positions have been posted and are now in the hiring phase, so we are very excited to be having that resource be implemented very, very soon. And that will enable us and ensure that we are able to continue this equitable outreach by taking vaccine and many other services that we provide out into communities. And while that team is being hired, we continue to provide services provide vaccine services at 40 Cox within our immunization clinic, which we integrated our COVID vaccine clinic into our immunization clinic several weeks ago. In terms of the testing efforts, the state testing resource StarMed has migrated all of their testing services now over to the Asheville Mall site. In addition, and I wanted to say that began on March 31st, so all of their services are now in one place at the Asheville Mall. I did want to remind everyone that the federal government has announced that households can receive a second round of at-home test kits for free from their federal program. Individuals can visit covid.gov/tests to sign up, and all that is needed is your name and your residential address. And so I just want to take a moment to encourage some of our community organizations, our churches, and other groups to take this opportunity to help households with limited connectivity or internet connection and access, or even limited comfort with technology, to help sign up households who may benefit from having additional at-home tests. And just a reminder for folks that having an at-home test kit is one way to help continue to limit the spread of a virus to others through quick identification and then limiting your contact with others. And as we locally continue to integrate many of the COVID-19 functions, like I mentioned, the vaccine clinic, integrating into our immunization clinic, many of those COVID-19 functions are now being integrated into our normal public health operations to reflect our current phase of the response. We have also modified the Ready Team phone line to match that current need and that demand to more fully transition COVID-19 calls into our existing clinic function. You might remember that the Ready Team phone line was established early on in the pandemic. I believe it was around April of 2020, to address community members' questions. Over time, that call volume has decreased. We continue to have Ready Team members on staff that do address COVID-19 questions. They support our communicable disease nurses and assist with COVID-19 vaccine immunizations. But staffing needs have decreased over time, and again, just gradually integrating all of that into our normal public health operations. So we began migrating all calls that were coming into the Ready line phone line, which is 419-0095, that's the Ready team line, to our existing 250-5000, beginning March 21st. So if folks were calling the 0095, it was automatically being forwarded over to the 5000, and we were answering those calls and transferring them appropriately to either our immunization clinic or to sometimes our economic services staff, because we were still having folks call about COVID financial assistance. So we do plan to discontinue the use of that extension, the Ready Team phone line, due to the low usage and the low demand, and we plan to discontinue it this week. This means that we will integrate COVID-19 calls into our normal phone operations at extension 5000. Team members, as I said, will transfer folks who call in to the appropriate section, and will retain that 0095 extension and reconnect or reinstate it if COVID response or other responses in the future warrant that. So we'll retain that for future use as part of our preparedness plan. The last operational item I wanted to update you all on is the federal government's recently launched Test to Treat program. I mentioned this briefly in the earlier weeks, but just a reminder, through this program, people are able to get tested, and if they are positive and treatments are appropriate for them, receive a prescription from a healthcare provider and have their prescription filled all in one location. Initially, this program was limited to large retail pharmacies. You might remember we had three CVSs in our area that were participating when it initially launched. The program has now expanded in many areas, including ours, to include urgent cares and local pharmacies. So folks can visit the website that I provided on the screen. You can put in your zip code or your city and find a Test to Treat provider in your area. And you can even set what radius you want it to look for. So as we were testing it out and put in 28801 and just used a 10-mile radius, we have about 6 providers now. If you use other zip codes and say 25 miles, you get up to 8 or 9. So depending on where you are and what radius you want to look for, there are more providers than just the 3 CVSs at this time. And lastly, I did want to mention that Buncombe County HHS provided a Let's Talk Treatment webinar and session last week to provide information about treatment and therapeutics. I do want to thank our own Dr. Jennifer Mullendor, our medical director, for facilitating that Let's Talk session, and our panelists who did talk about their treatment process, which included partners from Mercy Urgent Care, Pardee Infectious Disease, and MAHEC. And it was very well attended. So as I wrap up things today, I did want to just remind folks and leave folks with just a few things that are going to sound repetitive for good reason. So please be aware of symptoms and exposure to those with COVID-19. Get tested if you have symptoms or have been exposed. If positive and or you have symptoms, stay home and wear a mask around others. If you are high risk for severe illness, please talk to your provider about treatment or check out one of the Test to Treat providers in our area, and please stay up to date on vaccines. So one last reminder as I close out, that this is National Public Health Week, and our HHS Director, Stoney Blevins, will be acknowledging this week at your regular meeting later this evening. But while I had a moment, I wanted to just express my gratitude and respect for the many public health warriors here in Buncombe County and across our state and nation for the incredible job that they have been doing and continue to do every day. Much of what public health does goes unnoticed daily, but it is vital to our vibrant and growing communities, including ours here. And to all those dedicating themselves to public health service, I want to thank you. Please take a moment this week to think about the ways that public health is important to our communities and to our future. And thank you, commissioners. Happy to answer any questions you have.
I've got a couple, I guess, test to treat questions or clarifications. The GIS link that you sent, where you can search by your zip code, is awesome, and that's so optimistic. It's kind of like, it just seems like the way out of this, the way to live with this. It doesn't, though, tell a citizen or a patient very well what to do. So I just want to recap. You talk to your doctor first to get tested. You call one of those places on the map, or kind of walk us through briefly what you do if you think you have COVID to do that program.
Sure. So for the test to treat, it can happen a couple of ways. If you take an at-home test and it comes up positive, you can call a test to treat provider and say, I've taken an at-home test, and they'll talk you through stepwise of whether or not they'll accept that at-home test, because some will. Others will say, great, I want you to come in and we'll do an assessment and we'll retest. And then from there, they'll issue the prescription if you are eligible, and that's appropriate for your treatment. And then you will be able to fill that prescription right there in the location. So for folks who say, I just have symptoms and I'm not really sure, you can find one of those test to treat providers. You can call ahead and say, I've got really bad symptoms. I want to get tested and if possible, get treatment. And then they'll test you there at the site, and again, go through the same process of if you're positive and treatment is appropriate for you, that you'll be issued a prescription at that visit, and you'll be able to fill that prescription right then and there. So a one-stop shop.
Okay. Awesome. And in terms of qualifying, I guess right now, because of supplies nationally, you have to be of a certain age, or kind of where are we there?
That's right. So there are some criteria that have to be met. I won't go through all of them right here, but the providers at the test to treat locations will be able to assess very quickly whether or not someone is appropriate for treatment. But there are some qualifying criteria that folks will have to meet. Although now the actual supply has increased, so that's good news. And with cases being so low,
Yeah.
it's helpful to still, there's more supply on hand as well.
So in theory, with time and supplies increase, it's available to everyone? Is that kind of the
I'm sorry, can
general
you repeat that?
I was saying, in theory, as time goes on and supplies increase, it would become available to anyone and everyone? Is that generally what people?
That's the hope of, just like any other treatment that would be available for other types of infectious diseases, and think about maybe even flu and having some of that treatment available very quickly upon a positive test. That's the hope.
Yeah.
Yep.
Okay. Thank you.
All right, any other questions? All right, thank you, Stacy. Appreciate
Thank you all.
All right, next up.